Hello, everyone. Welcome to our Wednesday wellness. Should we call like wellness chat? I know like we have been calling all different names, but anyhow, welcome to our Wednesday wellness chat. And I'm Dr. Rayapudi, and this is my charismatic husband, Dr. Arjun Rayapudi. We are both lifestyle medicine doctors, and we help people uh, lose weight, get off medication treadmill, and reverse chronic conditions through our various programs and workshops through our not-for-profit organization called Gift of Health. And today, like, we are very happy to have, I would say, this is a very important uh, topic, I would say. I mean, like, yeah, like it is. We think it is obvious, but this is something that is not discussed much. So, like, we are very happy to have Dr. Karmi Patel with us. So she is a certified internal medicine doctor, and she's also both certified in lifestyle medicine doctor. So while she was a kid in India, she was influenced by herbal medicine, and she also saw like how Ayurvedic medicine has been practiced, and that also um, I would say inspired her to use whole food plant-based eating to prevent and treat chronic conditions that we see nowadays. So she has a beautiful family. She has an 11-year-old kid and an 8-year-old. And even like when we see Karmi, so we think, yes, she is beautiful, but instead of going for modeling, she chose to use her beauty, brains, and best efforts to help people, to help her patients transform their lives, and also like I would say, like she works in VA clinic in Knoxville, and there she inspires her patients and helps them to uh, use lifestyle medicine to prevent and reverse chronic conditions. So we are very fortunate to have her today with us. So welcome, Karmi. We are so glad you're here.
No, thank you. Thank you for those generous, kind words. Oh, goodness gracious. You guys are amazing. I'm just following the footsteps. You guys are leaders in this, and your work is phenomenal and so inspirational, both of you. And kudos, and like I was talking to Shobab earlier this week, definitely need to come for the retreat up there, to see the beauty of where you are and also the work that you do. So thank you for having me.
Oh, thank you so thank you so much. Yes. So, Karmi, what inspired you to get into lifestyle medicine? Like, yeah, I know, like, obviously, you have been trained traditionally as a medical doctor, and you went through your residency training. So, what inspired you on this path?
Okay. So that's a long journey, right? So that like anything is life is a journey. So like you said, I grew up in India. So I was actually 16 when I came to United States, and I did my undergraduate here, and then I went to medical school in Ross University, which is a Caribbean school. So it was then that's when this journey began, I would say, because on the first day of medical school, you get the white coat and you do the white coat ceremony and you take an oath and you say, I do no harm, right? You take the Hippocratic oath. So that was great. And then you do your 2 years of didactics and 2 years of clinicals, and you pass 3 exams and you luckily land a residency, and you do 3 years of residency, and you take 2 other exams, and hopefully you get certified to be a practicing physician. And in my case, I did internal medicine, right? And I joined the faculty of the residency that I trained in New Jersey at Somerset, New Jersey at St. Peter's University, which is Robert Wood Johnson affiliation with now. And so it was there, now I'm a full-fledged attending. That means I have the license to practice medicine. It's me who makes the decisions for my patients. There's nobody that I can look back at their shoulder and say, hey, is this okay, kind of deal, right? And so this is when I was seeing a patient that was referred to me from work, at their work. And he was like maybe in his late 40s, was referred to me because they had high blood pressure at the work screening, at the wellness screening at work. And so he came to me and he said, doctor, I was told I have high blood pressure. I need to see a primary and you're it, right? So I take his blood pressure and it's high, by JNC7 criteria, it was high numbers. And given that he had documented readings at 2 separate times that were high and my numbers being high, you can automatically diagnose that as a high blood pressure and say, all right, you need the medicine. So I take my magic, prescription pad, and write the medicine and say hydrochlorothiazide, 25 milligrams, take once a day. It is a water pill, so it will make you go a restroom extra. So take it in the morning and watch your salt, and I'll see you later. But okay, by the way, I do need you to do more blood work because we need to see your cholesterol now that you have high blood pressure, right? So then he does the cholesterol reading, and so his cholesterol is high. Okay, now that he has high blood pressure, he has one risk factor, so his criteria of high cholesterol treatments are different. So by that criteria, him being a male and you do all the risk factor analysis, he needs to be on a cholesterol lowering medicine. So I take out my magic prescription pad again and say, here you go, Lipitor, take it at bedtime. This one you can take it at bedtime because you can get leg pains, and I'll check your liver in a few weeks. So that, and he goes on, right? And so I say, all right, I'll see you in 3 to 4 months, 6 months, whatever. And he comes back and his blood pressure is fine. And we do labs again. And this continued on for like, let's say 6 to 10 months. And after that, when I redid his labs, guess what? His sugar is impaired now. Okay. So I got to check his A1C for diabetes. Guess what? He has diabetes now. Okay. And that was just like a brick hit on my head kind of moment for me, because it's like, wait a minute, this guy came to me with 0 labels, right? And now I've given him 3 labels: high blood pressure, high cholesterol, and diabetes. Meanwhile, both the medicines that I put him on, the hydrochlorothiazide and Lipitor, causes glucose impairness, impaired fasting glucose and insulin resistance. So in a way, I did the harm, but I took an oath to do no harm. But here is me doing harm now. So that was kind of a bit of a stomach achy feeling, like punch in the gut, like feeling like this is not what I signed up for, right? And at the same time, on the home front level, on a personal note, my son was a toddler at the time and he had a GI illness. So doctor said, give him Pedialyte. He couldn't tolerate that. So they're like, okay, fine, try Gatorade. So I picked up red Gatorade, okay, red because it's his favorite color, okay. I gave him, he drinks it, and next day he broke out in hives, okay. And it's like, oh my God, what did I do? Like when you're a parent and you're like looking at everything that you're putting into this child's body, and here's me trying to help him, and instead I gave him something that broke him out, right? So that began my journey about like looking into things, like what are we putting into body? What are we eating? So we started cleaning up things, decrease processed foods, eating better, cut out, juices, soda, things like that. And then a few years down the road, my husband, who loves to watch medical documentaries, And I'm thankful for that because, he stumbled on forks over knives, and so we watched it and it was like, oh my God, like I saw Dr. Greger and I was like, wow, this is it. I've found my mentors, and I bought his book, How Not to Die, read that. And with common links with Dr. Kaushik Reddy and Angela Reddy, who you had them on your show. They're good friends of mine, and we, got acquainted to lifestyle medicine, and we all went there and we met there, So when I got there first time, I still remember in Phoenix, it's like, oh my God, I have a tribe now, it's like you have a sense of belonging. And so knowing the Ayurvedic part of things, that food could impact, little things like, where we used to do like ginger and honey and all that things that for common colds and stuff, to now the other side of things, it just helped me make the pathway better because I could understand it from where I came from. So.
This is such an inspiring story, Karmi. And even as you were talking, it was giving me goosebumps.
Yeah, it's just like, like it's a self journey, unfortunately. And it's mainly, because I don't know how the medical school in India is, but here, more Western American colleges, we get 16 credits of pharmacology, okay, and 1 credit of nutrition, 1 credit, okay. So we are meant to be diagnosing and treating, right? It's like a pill for ill kind of notion. And if you think about it, this came from I think early days when the infectious disease and communicable diseases were so prevalent, right? We used to have one diagnosis, one pill, like antibiotics. Like if you have strep throat, you get amoxicillin. If you have pneumonia, you get something else. So that pill for ill notion is for those kind of diseases. However, right now, even with chronic conditions, we're still treating that with that mentality. And it doesn't work because these chronic conditions are not one factorial, right? They're multifactorial. So we have to address that.
Well, I would say you were lucky at least getting 1 credit for nutrition. We didn't have that even.
Oh,
Like,
goodness.
like in our textbook, it would be okay. If you want to treat diabetes, diet and lifestyle is the first step. That's
Yes.
the only sentence in the
Yes.
textbook. And the rest would be about the pharmacology, about like what
Yes.
drugs, what are the side effects, what do you do,
Yes.
that's what we were learning in our medical school, I would say.
Well, I'm glad we have found lifestyle medicine now, and it is making an impact in multiple colleges now. Mount Sinai has a good program, Loma Linda has a program, so it's sipping in, and I think it's our job to keep on educating.
Yes, yeah. And I would say like exciting times are coming up, like when lifestyle medicine is entering into medical schools and in
Yes,
residency training programs where like the doctors could learn like how to impart this lifestyle medicine to the patients.
exactly,
Yeah.
exactly.
Yeah. And I know today we are planning to talk about like like overweight issues or
Mm-hmm.
like even I remember like even few days back we were watching an old movie, old Indian movie, and we were amazed to see even the movie characters, they are looking so thin. And and even like the theaters or like the size of the chairs, like
Mm-hmm.
they are so small. And now when we are looking at everything, it is so different. I mean, whether the people or the places, I feel things have changed so much. And
Yes,
even like right like when we were in medical school, the amount of obesity that we used to see during that time like was far less compared to what we are seeing now, and it's
totally.
really mind boggling.
Yes, it is. It's funny you should say that. So, in 1996 is when I came to States, and US, the CDC does a obesity prevalence chart, and you can pull it up. It's free data on their CDC website. In 1996, they were like, most of the states were in light blue colored, which is like prevalence of obesity, which is defined as BMI greater than 30. BMI is a ratio, and you can calculate it, with a calculator online with your height and weight measures. And so most of the states in 1996 were light blue colored, so that means 10 to 15% prevalence of obesity in each of the states. And then you can chronically grow and look at all the maps from now. And the latest data is 2018. And all the states in the United States have obesity prevalence of more than 20%. Okay. There are 9 states that it's more than 35%. And most of those are southern states, and Tennessee kind of almost falls there as well. So yeah, it's striking difference on how it has progressed. And it's important because, when you look at the top 10 causes of death, right, in USA, 6 out of those 10, being heart disease. Even with COVID right now, when you look at COVID, COVID, heart disease, diabetes, respiratory diseases, cancer, kidney disease, all those are in top 10 causes of death. And when you look at that, the common factor of those causes of death, 60% is obesity. Okay. So obesity prevalence and having obesity puts you at much higher risk for any of these things.
So, like, we were looking at the comments in Facebook, and everybody is saying, "Oh my God, this is so refreshing and inspiring to hear." So, while you're speaking, like, we had one viewer asking the question, like, how to reduce the middle portion tummy for Indians? Will it disappear after whole food plant-based diet after 6 or more months? So I know, like, we will come to that.
Yes.
That's an interesting question that you asked. So, and like, as you were, I know you were mentioning about BMI
Mm-hmm.
so for our viewers, can you explain, like, so, because sometimes uh, like we like I was surprised to hear, like, when some of our participants were not aware, okay, like, what does this weight mean? Okay,
Yes.
so because when we see people around, and when everybody almost looks the same, we tend to think it's normal.
Mm-hmm.
So I know, like, you touched upon BMI. So what would you consider as overweight, and what would you consider as obese
So
in terms of
obesity
weight?
is more than 30 BMI, right? And overweight are numbers before that. And then for South Asians, the definitions are even different, right? But for me, like, I always tell patients not to get boggled down with the numbers, right? That's not what we're dealing with. What we need to understand is why it is important, right? So when we are obese, what are the medical complications of obesity? So obesity is basically thinking about fat cells everywhere in your body. Okay, so when you get fat cells in your pancreas, right, it causes inflammation of your pancreas. It leads to diabetes. When you have fat cells in your liver, it causes fatty liver, right? And that is actually number one cause of liver failure in United States right now. And then obesity is also linked to so many cancers, like breast cancer, uterine cancer, cervical cancer, colon cancer, the list goes on, right? Not to forget, obviously, the obvious ones, which is the heart disease, diabetes, dyslipidemia, hypertension, increased risk of stroke. Also, as we, our body circumference increases, right? Our point or gravity, center of gravity changes from our feet to our knees, right? And our knees are not meant to take the weight load and the workload. So we get arthritis, joint pains, and our body circumferences on top. When they have fatty deposit, then you cause obstructive hypoapneic syndromes, because your chest, the muscles don't move as much. Then you're retaining carbon dioxide, right? So you have breathing difficulties. And so many also of my female patients get gynecological issues with, polycystic ovarian syndromes, to infertility issues, to abnormal menstruations, and many other complications that we deal with. And then as a society, there's a huge economic cost and impact of this as well. There's like something like $4.3 billion lost a year due to job absences of diseases related to obesity. So as a society, the impact is even much worse. So which is why, it's good to understand what is obesity and how do we develop it.
Yeah. So, like, now that we see the effects of obesity, and like, even as a population, it's not that we want to be overweight. The thing
No.
is, it is difficult for us, like, given the environment that we're living in. It
Totally.
has been so difficult for us to, I would say, maintain normal body weight. And the other thing is, sometimes, I mean, these patients, when they come to the clinic or when they see their doctors, so they feel like, doctor, it's not that I do not want to lose weight, or,
Yeah.
but I'm doing my best, because these people have tried so many diets. I would say every diet under the sun, and they have looked up at information, and they do their best. I mean, they
Yes.
do their best to lead a healthy life. And but there's so much confusion out there, like
Yes.
what to eat, what to do. So could you touch upon, like, when you see your patients, like, what do you advise them?
Yes. So first of all, I'm glad you said the diet, right? So I love that, to reference that word, because when you look at diet, it's DIET. Die. There's die in it. So don't diet. Diet if you want to die, right? So because, yeah, I try to explain people that diet is like a fad, as a fashion. Today it will be keto diet, yesterday was paleo, then it will be something else, right? So it's just like a yo-yo, and you're chasing something, right? So instead of looking at diet, what is the focus? Like you said, people want to be healthy, right? And you look at the word healthy, it has heal, die. It's heal, die, heal yourself, right? And how do we heal ourselves? So that's the concept that we have to understand and learn. So, and we have to, I like to explain to patients about calorie density. Okay, can I put up a slide here? Okay,
Sure.
so this is an important concept. Okay, what we need to understand is calorie density. And so this is what 500 calories look like in your stomach from different things. So as you can see on the left side of the slide is fruits and vegetables. It's low calorie density, and it would be like 100 to 600 calories per pound, right? And then on an average, we eat 2 to 3 pounds. 3 to 4 pounds a day. And then in the middle, we have the potatoes, rice and beans, meat and cheese, which are moderate calorie density. So they are like 900 to 1400 calories per pound. And then the high calorie density, which is diets high in oils and saturated fats with meat, cheese, butters, salad dressings. And they are 1400 to 2300 calories per pound. So when you do the math of if you're eating any of these things on any given day, let's say if you're very good in fruits and vegetables and things like that, you're eating 2,400 calories if you're eating 3 to 4 pounds of food a day. Versus if you're heavy on cheese and oil, then you're getting 90 to 100 calories per day. Now, that's so many excess calories, right? We need at least what, 2,000 calories maybe a day to maintain weight or activities, unless you're an athlete. That's different. We're not going to talk about that aspect. So all those 7,000 calories are excess calories, okay? And whenever there's excess calories, the body just thinks that it needs to store it, okay? Because we need to use it for later or whatever it is. It just stores it. And when it stores it, that's what the fat deposits are, right? So it gets fat deposits, everywhere in your muscle, in your liver, all around. That is obesity. So that is what's causing the obesity. So we need to understand that and change what we're eating. See, unfortunately, currently, what we eat is what we call the SAD diet, right? Standard American diet. And that is what? 53% processed foods, 32% animal protein, and 11% is vegetables and fruits. But out of that, 50% is like ketchup and fries, right? Like even at schools, ketchup is considered, and tomato sauce is considered a serving of vegetable, believe it or not. So that's where the problem is, that we are so inundated at all these processed foods everywhere that we need to learn what we need to eat. And the easiest way I explain this to my patients is to think about how many hands does the food touch. What do I mean by that? Okay, so when you go to a grocery store and you're buying something, right? So I'm buying an apple. Okay, so I look at the apple and say, all right, the farmer grew it, somebody picked it, packaged it, and came to the store, right? It's still whole intake apple. Now I go look at the shelf and I look at the applesauce. Same apple had to go to some factory, got peeled off, got boiled, got mushed, got vinegar in it, got cinnamon in it, got sugar in it, got packaged, labeled, put in the shelf, right? So each level of that process, or each level of those hands that had touched, decreased the value of nutrition in your food. That's it. That's simple. Okay. So when you're buying things, you have to think about the number of hands it touches. The more hands it touch, we don't touch it. Okay. So does that make sense?
Beautifully said. And it's so simple to think the more number of hands it touch,
Yes.
it's better to avoid
Yes.
them. Absolutely. So, like, given and especially this fat has different distribution. So, like, you have very beautifully explained, like, when fat deposits in different organs, like, what are the effects? And some of us see our most of our fat deposited in our tummy region, and like, we think, okay, like, how do we decrease our tummy fat, or how do we decrease our visceral fat? And as you have explained, this whole food plant-based, like eating veggies, as you have shown in your
Yes.
stomach bag. So when we follow that principle of calorie density, like, it's easy to lose weight, and at the same time we feel
Yes.
full. We don't have to starve ourselves to get rid of our tummy fat.
Exactly. And that's the idea, that when you're eating the whole food plant-based diet, it is first, you don't have to worry about what you're eating. And then secondly, as you develop that healthy lifestyle, then the pounds come off. That's the side effect. That's what I tell patients. I never focus with patients about losing weight per se, okay? Because that shouldn't be the goal. The goal is to be healthy. How can we make our blood vessels healthy? How can we make the liver healthy, right? So the goal is to be healthy. And in doing that, the weight will come off, okay? It's just, and like, when we make the weight loss a goal, I feel like it's always a yo-yo, because you achieve that and then you feel like I've done it, and then you bounce back and you revert back to what you were doing before. So then you gain it all back, right? So we don't want to do that yo-yo. So some of the things that I discuss with patient is negotiating of what we can change, right? So when I see a patient, I ask them about a quick general diary of their day food things, right? So it's easy to ask like, how many fruits per day do they have? How many cups of vegetables per day? How many leafy greens per day? How many beans per day? Soda intake and meat intake, right? So even in that general 4 or 5 things, you get an idea of what proportional of food that they're eating. And by and large, they're always eating the standard diet. And when you want to make the change or ask them to make the change, um, I don't like to attack and say you're doing this wrong or this is the culprit, because remember, food is emotional, right? Because it's attached to feelings of whether it is the family recipe or my mother's thing or cultural thing. It is very emotional for us. So when somebody just says that this is something that you've been doing for 30, 40, 60 years that is wrong, you're not going to take it well. Okay, you're going to go into defense mode. My grandpa did that and he lived 80 years old, and he was fine, kind of mentality. And so instead of that, what I like to discuss with them is, what can we add? Okay, what is it that you like? Which vegetables can you do more? Can you do 3 more vegetables, right? And the good app that I like to do this with is Daily Dozen app by Dr. Greger. It's free and it has a checklist, So even for me personally, when I started my journey, it was great when I had the app, because then I tick off the things that I was eating. And then when I'm hungry, I open the app and see what I needed to eat and try to grab that. So you become mindfully eating what you need to eat versus what's just around you. So for patients or for whoever, as who is trying to start this journey, the lifestyle journey, I say go on the app and pick 3 things. Whatever 3 things that you can tick off for the day, take those 3 things and stick with it. Stick with it for a week. Okay. Once you get that down, add more things and try to keep on adding as much as you can on the list. Okay. The idea is to be consistent and persistent. Okay. Because this is lifestyle change, right? We have to continue throughout our lifestyle for it to work, right?
So well said. Even as you were mentioning about like when we keep weight loss as a goal, we
Mm-hmm.
are actually setting ourselves for failure.
Yes.
And yeah, that is something we do not have control over. Like even though we keep a goal, I'm going to lose 10 pounds or 20 pounds, we have no control like how much we are able to do. The only control is the process, like how many
Yes.
veggies I'm able to add, how
Mm-hmm.
many fruits I'm able to add, or how am I going to change my diet. And also the other beautiful point you brought is, yes, it's the grandma recipe or
Yes.
our mother's recipe that we like. And and that's why like we talk about plantifying. So even no
Mm-hmm.
matter whatever culture you come
Yes.
from, whatever you are used to, okay, if this is the way you're cooking, see if you can add more veggies to it and see if you can take the processed component out of it.
Yes.
So see if you can switch the milk, like instead of
Mm-hmm.
using dairy milk, see if you can use plant-based milk, which are less in calories when compared
Yes.
to the regular milk, and they're also like less in saturated fat. So
Mm-hmm.
similarly, so we show people like how they could just take out the foods that are not serving the purpose or that's not so beneficial to
Yes.
them, and substitute with nutritious foods and keep the recipe same, like you can still enjoy and
Yes.
plantify things.
Exactly, exactly. And that works, and like you said, any recipes, like, I make my mother's recipes of Indian curries, but I don't use oil, and It tastes fine to me. So, and remember, the other thing you have to remember is that taste is acquired, right? So it takes 28 days for us to like something, because that's the recycling of the taste buds. So give it a try for 28 days, to make a change, even if you're trying something new, right? Like when we used to give babies the food, like doctor said, to try 4 times, right? Like, and it's wise because of that whole notion. But that's what it is. The other thing I want to mention is, like, in that Daily Dozen app now, Dr. Greger has came up with the new book, How Not to Diet. And based on that, in the same app on the corner, there's 21 tweaks. And those are 21 tweaks that help you lose weight. And it goes into talking about increased metabolism with certain foods. So certain spices, vinegar, cumin, cinnamon, all that stuff is in there that you can add on to your diet, that can also help you burn that fat, like someone asked about the abdominal fat and things like that. Now, mind you, this is just one part of, comprehension about obesity or weight, right? The other aspects are, obviously activity, stress, and sleeping, and all that needs to be factored in too, because you can't just control or treat one factor and get the results. That's not going to work.
Mhm. Very well said. Yes. So we have a question
Mhm.
here. So okay, so this says, so for your eating recommendations or plans that you use, uh, do you, yeah, do you use the Eat to Live plan by Dr. Furman at all? Does that play into it for somewhat you recommend? Yeah. So yeah, so typically they're asking like, what do you recommend to your patients or participants? And I know out there you have like you will be hearing from a lot of people, and there are a lot of plant-based doctors out there, like Dr.
Mhm.
Joel Fuhrman,
Mhm.
Dr. Greger, and Dr. McDougall, and like there are many out there,
Yes.
and we sometimes we tend to focus on the differences, but like
Mhm.
if you really see what they're recommending is eat your fruits, veggies,
Yes.
whole grains, beans and lentils, nuts and seeds. if
That's right.
if this is what you can include here in your diet, oh my god, you
That's right.
like you're set.
Yes. Whole foods, I mean, that's it. It's as simple as that. Mostly plants, whole foods, right? One, if anybody wanted a great handout or something, see, nutrition.va.gov, I think, is the website. If it's not correct, I will get back to you and you can put it in your feed. It's a free resource from Veterans Affairs. The website is, that you can access. And in there's a plant-based diet handout.
Mhm.
And that is the handout that I use for my patients. And it has categories of vegetables, fruits, beans, whole grains, nuts, seeds, and portions in it as well. So that really helps my patients to start with, because it gives them categories of different things and has list of common vegetables and fruits and beans that are in there. See, some of the people don't even know some, other vegetables that they could eat, or other beans, or, around here, the only beans that we know is the pinto beans or baked beans. They don't know about, chickpeas and the black eyed peas, or, like, the lentils or pulses, or, all the other things that we use from, red lentils and green lentils and all that kind of stuff. So it's nice to expose them to the variety, so in even fruits and vegetables. So that is a great handout, and if you can find the link, I can send it to you and you can share. So that is one thing that I give printed to the patients, to take home with, if they are not able to do the the app or computer savvy or something like that. That's a great handout that I like to use.
Yes,
Yeah.
yes. I mean, I agree. We have wonderful resources out there.
Yes.
And when it comes to, okay, when we see, okay, this is what you need to eat, this is the meal plan. So sometimes we think, okay, just give me the recipes, just give me
Yes.
the meal plan, and I'm going to do. But what we tend to forget is food is about comfort,
Yes.
about culture, about
Hmm.
how do we navigate the social situation, what do you do when we are stressed. So it encompasses a very large area, and unless we are able to address all those aspects,
Hmm.
it's very difficult to bring the lifestyle change. I
Yes,
know
it is.
this changes are so simple, like it's as
Yes.
easy as saying, okay, eat your veggies and like whole grains, and then like I don't know if I can do this. So,
Yes.
sometimes they would be like, okay, maybe this is too much for me.
Yes, it is, and you do come to that, and you have to tailor everything personally. I'll give you a story about a patient of mine who was a truck driver, and he got diagnosed with diabetes with A1C of 13. And then being a truck driver, he would lose his license if he goes on insulin. Okay, so he came to me with very panic, and he's like, doc, I cannot afford to lose my weight, lose my job, and I cannot go on insulin. And that was my perfect moment, because I'm like, yes, I got this, now I'm equipped to say I can help you, right? So I said, all right, if you don't want to go on insulin, I can tell you exactly what to do, and you will not go on insulin, but you got to help me. I cannot do this just myself. You have to help me. It's a two-way street. So that was a great buying chip, right? And so he's a truck driver. He drives long hours. So here's what he did and what we did. We came up with. He has a cooler in his truck and a slow cooker. He stops at Walmart at 2 o'clock in the morning because that's the only time he can park his semi there. He would buy all the frozen vegetables and fruits that he can see in the frozen aisle, and beans, and whole grains, so rice, and quinoa, right? And he started making soups and stew in his slow cooker, and eats the frozen vegetables and things like that. And his A1C came down from 13 to 6, okay, in 6 weeks.
Wow.
Okay. The next time when I had seen him, now I see him, and he will have his duffel bag, and he showed me what's inside it, and he has apples and pears and bananas in his, in the bag. Because the first time I met him, I had showed him my bag, and I said, this is what I snack on. My bag is always full of vegetables, so if I'm hungry, I can always reach out to it, and I'm not going to the vending machine, or I'm not going to the nurse station, because God knows the nurse station is the bad place to go, right? I'm sorry, but we just have candies and donuts and, chocolates. Um, so you have to, come up with personal plans for each person that would work with, certain recipes. I try to, be innovative and try to teach them about different recipes or things like that we can tweak, that they can still have their mother's recipe, but it might be a little bit better now. Sometimes we do substitute the potatoes out, do sweet potato more than the regular potato and things like that.
Yes, it is so well. And just as you have shown uh, this beautiful example in the case of your truck driver, like we have beautiful examples like with our participants, like where they were able to lose weight just by using all the techniques that you have
Yes.
mentioned, like by changing their diet, and where even they have the strong motivation where they don't
Mm-hmm.
want to go on medications, and where they want to lose weight, and fortunately we have been also able to help like hundreds of people like lose weight, and we feel so blessed when we see these
Yes.
people like losing 100 pounds, 50 pounds, and it's really
Yes,
amazing. And I would say that's what
it
keeps us
is.
going. Like when
It's so
we
rewarding.
listen,
I'll tell you
yes,
another
listen
story
to
of a
all.
patient of mine. So this was a
Mhm.
veteran who was already labeled with chronic diseases with multiple medications. So high blood pressure, diabetes, high cholesterol, the classic syndrome and gamut of things. And I met him when I started VA, and we were talking about diet and things like that. And I said, if you do better with your diet and things and exercise, you could come off the medicines. And I always like to plug that in, and because most of the times patients don't know that. They just think that once they're on something, they have to be on it for life. And that's the notion that has been in our society and in culture, unfortunately. So, he's like, wait, what did you say? You said I could come off the medicines? I'm like, yes, I can work with you and you can come off these medicines. So he's like my classic textbook patient. He just went all out. He watched Forks Over Knives. He went completely plant-based, um, dropped his agency, and I started taking off his medicine, and now he's off the medicine. He lives by the motto of eat the rainbow, and he has converted his wife. He has converted his friend who had gout issues, and now he's spreading the message in his society. And to me, as a doctor, doctor is to teach, right? So that is the best gift, if you can teach your patients how to live a healthy lifestyle. And then they teach. That's like even like double. So and that's what keeps me going. And I'm so grateful to have lifestyle medicine that has given me those tools to be able to do that.
Excellent. That's for sure. So we have one
Sure.
question here for me. So is there anything I can do to reduce high blood pressure on plant-based foods?
Yes, so definitely. So here's the analogy of blood pressure, okay? I love this. High blood pressure. So imagine your vessels are plumbing system in the body, right? And like the pipelines outside, they get corroded or stiffened based on what we are eating, from salt to cholesterol. So pipes are getting clogged, pipes are getting stiffened. Now, the good thing about plant-based diet, or when you're eating high fiber diet, which is the plant-based diet, the fiber is the Drano. Okay, to me, I refer it to like a Drano, and it cleans out things. And when he's doing that, when the pipes are getting clean, they're not stiff anymore. They don't have the pressure anymore. Okay, so yes, plant-based diet helps with high blood pressure. There are particular, definitely things that you can also add on. I'd like to recommend to do flaxseed, ground flaxseed powder, 1 to 2 tablespoons a day. That is shown to reduce blood pressure and reduce cholesterol. But by and large, for hypertension, low sodium diet, which would be if you're eating a lot of plants and greens and high fiber, you're going to be low sodium diet anyway. And that would definitely lower your blood pressure.
So, like, what if they're already on plant-based diet? So they're eating whole foods, as you suggested, like low sodium, eating mostly plant foods, and if still their blood pressure is high, uh, do you have any further recommendations on decreasing their blood pressure?
You would have to do a detailed survey on, how are they cooking their foods? Is there any fats or oils used in their foods? Are they overcooking the foods? And then, like I said, you can definitely add the flaxseed. And then that, if food is completely to, whole food, plant-based, no oil, no salt, then you have to start looking at other things. Is there stress? How's the mood? How's the sleep? Is there sleep apnea? So you have to look at secondary causes by then.
Yes. Thank you, Karmi. And did we have other question here? Okay. So can you reverse fibrosis in Nash with plant-based diet?
So Fibrosis is difficult because fibrosis, if you have fibrosis by definition, that means there's scarring, right? So that is some of the damaged tissues. So I'm not exactly sure on the studies, if there is any on that particular issue, because to me, when there's fibrosis, I feel like it's permanent damage. But obviously, if you still go on plant-based diet with Nash is just non-alcoholic fatty liver disease, then you will still prevent the going into cirrhosis and failure. So I would still recommend it.
Yeah, I would say if even if you don't reverse it, you will prevent the progression of it, right?
Exactly.
So which is
It will
because
halt the progression.
yeah, if you continue to eat what you eat and you got NASH, that's the fatty liver disease. That means you're
Yep.
setting up yourself for progression.
Yep.
I've seen in many of my patients with fatty liver just reversing, but
Yes.
once they're in a fibrotic state, you may not see the
No.
fibrosis reversing, but still there is no progression.
Exactly. You can, in same, even the kidney disease, I get asked that a lot too. Kidney disease and kidney function I've seen improve a lot, as long as, again, there's, no other sclerotic disease already.
Wonderful. Yeah. There is another question here. I gave up sugar and oil, but too hard to give up salt.
Well, so the trick about salt is you got to spice up your foods with other things, other spices, use garlic. So garlic is another one for high blood pressure, right? So garlic, ginger, cumins, cilantro, basil, oregano. You have to get the variety of spices in order to get rid of the salt in diet, or added salt.
Yes, and just to add to that, like you could also add more things that are naturally a bit salty. Like if you're adding a little bit of celery to it, if you're adding a
Yes.
bit of spinach to it, or
Or even like different kinds of
different kinds of fresh herbs,
herbs and spices.
and
Herbs, yeah.
we tend to add a little bit more lemon, and that also really helps, like to a little bit of sour taste,
Yeah.
decreases the need for salt. I mean, you don't have to completely cut the salt out.
No.
Just, one thing that will help with salt uh, uh, is instead of adding salt into the dish, you just cook the food
Yep.
without salt, and you serve the food, like either if you're making a lentil soup or a vegetable stew, take it in your bowl and then sprinkle salt on top.
Yes.
So with that, you end up using the less salt as well.
Less salt. That's right. That's right. Also, for transitioning, when patients are transitioning, nutritional yeast is a great substitute as well. Miso is a great substitute too.
Yes.
And tamari you can use in certain sautés that are all, other salt substances. I like to use miso in curries and things like that because it's salty. So,
Yeah. Like what I would say, one thing to keep in mind when we think of salt, it mostly comes from the packaged products
yes.
and processed products. And when we get rid of them, we are actually automatically getting rid of high salt intake. And
Exactly.
and if we are adding that little bit of salt during home cooking, that's good because that's only 5% of the salt intake, believe it or not.
Exactly.
Like
Yeah.
most of the salt intake is coming from the packaged products.
Packaged foods. Yep. Exactly.
And we just want to clarify, like to all the listeners, like we want the food to be enjoyable and
And
Yes.
tasty,
tasty.
right? Because what is
Yes.
enjoyable and what is tasty is what is sustainable. And if you feel like deprived on this process, right, like then it's like what you said, diet. You feel like you're dying, and then you give up.
Yes. You don't want to do that.
Yeah.
Yes. And people don't realize that you can cook so many things and variety of foods. I'm not eating a salad bowl every day, right? So it's just, different way of cooking, different, need to learn different things. It's a learning curve, but it's doable. The other app that I tell patients if they're really wanting to try things in different recipes is the 21-day vegan kickstart by PCRM. which is also free. And that gives you 21-day meal plan with breakfast, lunch, dinner, snack, and has a grocery list and also gives you videos of those recipes. That's a great tool as well. And obviously forks over knives, even your website. I refer to all my Indian patients with your websites too. Which has a lot of recipes to try out, and it's a trial and error. You have to see what you like and what you can sustain with.
Absolutely. And like I feel like we can just go on and go on. And I was like, oh my God, time is running so fast. We're almost coming to the close. So I was thinking, like just to summarize, would you be able to offer 2 or 3 tips, like what people can do, like when it comes to reducing weight? What are some of the things that they can do, and that they can get started on?
Okay. So, yeah, basically, what I would say is to do an inventory of what you're eating. So, where you know where you're at. And then just get any kind of, like I said, the handout or the app, the Daily Dozen or the nutrition handout, and pick things that you like, 3 things, and then start with that. Um, the last point I would always say is to have the activity. So if you can just do even 20 minutes of walking a day, it will enhance your lifestyle changes that you're trying to do. It will help you with your goals to get healthy.
Excellent. And I know, and we have seen this in terms of our participants too. Like making lifestyle change is simple, as you can see. Like it's free, except the food. Everything is free to do, and it's like if you look at the steps, it's easy, but we feel it's very difficult to do. So
Mhm.
that's why like we have kept many resources. So for some of you, as we said, there are free resources available out there which you can take, like where you can find the recipes, the
Mhm.
meal plans, what to do. But like what I have noticed, especially like when we want to bring about a lifestyle change,
Mhm.
we need 3 ingredients. Like we need the knowledge, like we need
Mhm.
what to eat, what not to eat, the recipes. At the same time, we need the skills. And building skills takes time. And at the
Mhm.
same time, we need the support too, like when
Yes.
we want to bring out a sustainable change. Because sometimes like what we notice is like even though we have the knowledge and skills, and if we don't have the support, we are not able to maintain that change sustainably. So
That's right.
that's why like even here at Gift of Health, like we have kept different supports and resources so that like people can utilize that and bring about that sustainable change. Like earlier when we started out, like we used to have 3-day programs or 6-week programs, and we have seen like massive results, and we were really overjoyed to see. But at the same time, what we were noticing is like just like your truck driver example, and
Mhm.
like all these people were doing great, and after like 1 or 2 years, what we used to see is again like falling
Mhm.
back, so which was very hard for us to see.
Mhm.
So that's when we realized, like, to make that change sustainable, how important it is to have that supportive
Mhm.
environment. Like all the participants and all the viewers who are watching this, like one thing we would say is to immerse yourself, like take advantage of immersion program. The thing, we are not saying that you cannot do it on your own. When you do it on your own, maybe it may take months, but like when you're doing this immersion programs, as you have mentioned, the 21-day
Mhm.
kickstart program or the other free resources or courses that we are offering, the advantage of taking those immersion programs is like you also get the support
Yes.
of other people around you, and your growth is fast tracked.
Yes.
Like
And
you
it
want
gives
to.
you accountability too, I suppose, because when you go as a group, you're meeting other people, it's your network, and then you're doing this together. And that's beautiful. You need that. You need that support and accountability factor into it for you to keep going until you're a pro, basically.
Yes.
Then you can sustain it there.
Exactly. So we highly recommend you take advantage of that.
Yeah, thank you so much, Karmi, for joining.
No, thank you for having
Yeah,
me. It was amazing. Thank you.
yeah, thank you
Yes.
for all the listeners, and we will see you in
Next
our
week.
next session.
Next
Yeah.
week.